If we think the devastation happened in New York City, we honestly have not seen anything yet. In New York City, there's 62 hospitals within that one city. In South Carolina, there are 10 counties without a single hospital. That's more than 1 out of every 5 counties, no hospital. When this virus swoops through the South, of where poverty has set roots and called itself home, we're going to see this pandemic taken to a whole nother level because we don't have the resources already in place. Systemic racism eats into literally every sector of what we define as social determinants of health. And the way that the system is set up is Black and brown people will be sicker.
Typically, the way that financial is measured is at the state level. This is financial well-being mapped nationally via the Share Care Wellbeing Index. Financial well-being is defined as managing your economic life to increase security and reduce stress. That includes everything from your income to whether or not you're satisfied with your standard of living to whether or not you have enough money to buy food. And what you can see here is that we have states primarily in the Bible Belt that have relatively low levels of financial well-being versus some of these areas like Washington and in the Northeast where we see higher levels of financial well-being.
The impact is going to have to be state-based, county-based, and then literally zip code-based. Because what we know within the same zip code, we have differences in neighborhoods. And we can't ignore that, especially if you go down to zip code level, because you all share the same grocery store.